And really in Mexico, right now, don't have access to the CAR T cells therapies. In this moment, many groups develop academic strategies for give access to the free population to this type of the therapies. Right now, my group, for example, developed one collaboration with the Clinic Hospital in Barcelona for obtain the plasmids for versus CD19 CAR T cells and building these CAR T cells directly in Mexico with one strategy over the basis to the building these CAR T cells in the CliniMacs platform. And in this moment, many problems it's complicated to start these programs in Mexico. The principal problem is in Mexico don't have one regulation. And in this moment, this stopped the start for these programs. However, it's possible and in this year or the next year to have we start this program in the clinical research patients with 55 patients in the first time for the evaluate the facility for the or accessibility for this type of the strategy in Mexico.